What if a huge health upgrade isn't a new supplement but a simple change to how you sleep? This isn't a new idea. In fact, ancient Egyptian pharaohs were sleeping this way over 3,000 years ago. It was rediscovered by a British engineer, inspired not by history, but by the physics of how sap flows in trees. This is inclined bed therapy, a technique that uses gravity to supercharge your body's natural healing while you sleep. In this video, we'll break down the science, show you the surprising benefits, and explain exactly how it functions. First, what is it exactly? IBT means raising the head of your entire bed by 5 to 8 inches. This is not the same as piling up pillows or bending at the waist. The goal is maintaining a straight spinal alignment. The core idea is that sleeping perfectly flat might actually hinder our body's fluid dynamics. Let's start with your blood. Gravity on an incline assists venous return, blood flowing from your limbs back to your heart. What does this mean for you? Better circulation can help reduce swelling in the legs and aid with issues like varicose veins. So it helps circulation, but what about the body's cleanup crews? IBT also supports our lymphatic system. Your lymphatic fluid has no pump like the heart. It relies on movement and gravity, so that slight incline provides constant, gentle assistance. Now for one of the most documented benefits, acid reflux. It's simple physics. The incline makes it much harder for stomach acid to move upward. The same principle applies to your airway. The incline helps prevent soft tissues from collapsing, reducing snoring and even easing sleep apnea. For back pain sufferers, the gentle slope can reduce pressure on the lower back and promote a more natural spinal alignment. Better circulation, less reflux. But what if the most important benefit of IBT happens inside your skull? Before we answer that, consider this. In hospitals, raising a patient's head is a standard protocol to aid breathing mechanics. This is also why pregnant women often find relief sleeping on an incline. It helps with reflux, shortness of breath, and back pain. So you want to try it? How do you get the angle right? The sweet spot is a 5 to 8 inch height. Too steep, and you'll just slide down. But there is one non-negotiable safety warning. Inclined sleeping is extremely dangerous for infants as it can obstruct their airway. Never do this for a baby. Now, let's tie this all together. Remember the benefits for acid reflux and sleep apnea? By reducing these disturbances, IBT leads to fewer awakenings. Fewer awakenings means your body can spend more time in the most vital phase, deep, restorative sleep. And that brings us back to the brain. During deep sleep, the glymphatic system activates. Think of it as the brain's dishwasher. This brainwashing process relies on cerebrospinal fluid flow. Research suggests the gentle incline helps this fluid drain more effectively. A more efficient glymphatic system is linked to better cognitive function, memory, and may help protect against neurodegenerative diseases. So when people report higher energy levels, it's the synergy of better circulation, deeper sleep, and more efficient brain detoxification. We've gone from ancient Egypt through modern engineering to see how a simple 5-degree slant can harness gravity to help our bodies work better. It boils down to 3 key effects: improved fluid dynamics, reduced physical obstructions for breathing and digestion. This confirms our initial point. Inclined bed therapy is a powerful, non-invasive way to use gravity to improve your overall health. If you're struggling with any of these conditions, IBT could be worth trying. Do your research and talk to your doctor to see if it's right for you. Sometimes the most impactful changes are the simplest ones. Your path to better health might just be a few inches away. Harness the power of gravity. Start sleeping in harmony with your biology.